of the night, and I'm just going. She's going to speak about the mental health and COVID-19, and please welcome Pamela Awudi, and she's a nurse and runs her own healthcare business as well, which is Shalom Healthcare Limited. So please, Pamela, welcome to the stage.
Thank you, Stephanie, and hello, everyone. And many thanks to Nadia and SJS Awareness Team. Well done for putting this piece together. I deem this opportunity and a privilege to be able to be part of this presentation tonight. So, without much ado, thanks to Ella and Isaac. You've given a lot of insight about the COVID itself, so I'm not going to bore you with that. My focus is on mental health. So mental health, I know a lot of you, everyone on this platform has an idea of what mental health is, but briefly, definition by World Health Organization says is the state of mind. I mean, how you think, how you feel. I mean, how you go about your day-to-day activities without it impacting on each other. So the way I'll break it down is if you are able to manage your day-to-day affairs without it being impacting on you, i.e., you have a home to run, you have a job to do, and it does not impact in you negatively. It means your mental state, your mental health is intact. But whereby these things interact, I mean, impact has a negative impact on you, that it causes like things like sleepless nights, agitation, anxiety, then there is whatever that activity is has triggered some form of mental illness. Because of time, I'm going to actually focus on the COVID itself, pandemic, and the impact it has had on mental illness. So first of all, I mean, before COVID came into being, there were mental health has always been there and it will always be. According to the World Health Organization statistics, like over 400 million people suffer from mental illness. And in the UK, one in every person, one in every 4 people will suffer from mental illness. This figure include both adults and children. A lot of people tend to think that, oh, with children, mental health is only focused to a certain group of people. No, I now specialize in children with mental health issues, and we see as young as 5-year-olds with suicidal thoughts. They want to die because if somebody said something that upset them, or they have witnessed a trauma, or something hasn't gone right, and that has triggered mental illness. So all these, and when you look at, then there are mental health disorders. So it's grouped into different categories. We have psychotic disorders. We have, when I say psychotic disorders, you might hear things like schizophrenia, paranoid schizophrenia, chronic schizophrenia. Those are psychotic disorders. There's depressive disorders, anxiety-related disorders, personality disorders, eating disorders, and the list goes on. So all these conditions and disorders have been existing. Then COVID happened. So how did COVID actually impact on mental illness? Or how did COVID actually impact, trigger mental illness as well? So like I said, is grouped into different categories. But the existence of this pandemic, this pandemic coming into being, has also caused a lot of anxiety, including myself. I mean, the first time I was told, I was working in a busy London hospital in A&E. So in every A&E, there are mental health specialists, like mental health professionals who actually see people who present to A&E with mental illness. I got a referral for the first time, and there was all this anxiety about COVID. Everybody, colleagues were dying here and there. And it was very scary for us as professionals. And as the various speakers have said, people from our background, we were more careful and more anxious than anything, because like our colleagues were dying, other people in ITU. I mean, one of the doctors in our team was like, anytime she goes to ITU, she doesn't see I mean, if she sees 10 people in ITU, about 60% of them are from Black and ethnic minority backgrounds, which was so scary. I was told I had to see a patient who had COVID symptoms. That alone, without seeing the patient, I started coughing. I had taken the referral, had taken the history. I was about to go and do the assessment. But before I walked from where I was to A&E, where the patient was, and in those days, I mean, it's still on now. I don't know if any of you have been to A&Es. It's divided into zones. So there's a red zone that is for COVID patient. There's an amber zone. So it's all like the anxiety. I mean, going through these places was enough to cause anxiety, even in the professionals, let alone the patients that were presenting. I worked there and I was still coughing. So it was all psychological. Eventually I got to the patient, and the patient started swearing at me and asked me to leave. Didn't want to know about me at all, which was okay. I would not force anything on them. I went back to the office and I was still coughing. It was all anxiety. So with COVID, I mean, and there were a lot of cases that came, I mean, as a clinician, in a real world, practical world. COVID impacted on businesses. It impacted on people's lifestyle. People's routine were broken. So with that, we had a lot of cases coming in where people had lost their jobs, had lost their homes. And I mean, the government did a lot. Like there was a street link or providing, I mean, accommodation for people who had been homeless because of COVID. But it was still difficult for a lot of people to adjust to that, whereby you've had your job, you've had your comfortable place, and now you have to just go and squat in a hostel with maybe people you never want to have anything to do with, like drug dealers, drug people addicted to drugs, all sorts of people. So it's like there were like mental health conditions. The existence of mental health in the UK, it was already present. Then this pandemic, so it triggered anxiety with, I mean, people who didn't even have any incidents of mental illness. And people who had underlying condition and mental illness were also another category who were affected, in the sense that now accessing services became difficult. So whereby people had a form of mental illness and were relying on like community professionals to provide services like a face-to-face, or I mean the normal visits, all of them had to be cancelled. So it triggered more anxieties, and it's still the same case now. But what has happened is, because of COVID, the government have introduced a new system. I mean, a lot of things have changed. Apart from the fact that it's imparted on services, it's imparted on individuals affected with it. What is being done is services and facilities, resources have been introduced to make working with patients safer, even though it's not the best, and it's so frustrating. I mean, is for now is the best thing to do to actually keep both professionals and patients safe. So, for instance, a lot of contact with patients are being reduced. I mean, from face to face to either video or telephone calls, which is not the best for many patients who are socially isolated or do not have any form of support network or do not have access to enough. I mean, some people are even anxious about going on the internet or using their phones for, but with the pandemic and the state of things now, the government is trying to get everyone to understand and adapt to changes in mental health. So with services, with mental health services, I mean, if in every area there is like a single point of access, if you, wherever you live, if you Google single point of access in your area, there's a number you call. So when you call that number, there are professionals there that can triage you, can speak to you. You have access to clinicians who will speak to you. I mean, describe your symptoms. They might once they take your information, they will be able to advise you whether you need to see your GP or you need to see a psychiatrist or they will be able to signpost you to the relevant services that can provide you the support you need. And also, when it comes to services, I mean, with COVID, a lot of people, it has triggered depression in so many people. I mean, there are practical situations where people have been stuck indoors. Not that they don't want, they are afraid to go out because they are afraid of getting the virus. Even with with PPs and they are so scared. It's all anxiety related. So such people live indoors and they are not able to interact with anyone outside. And a lot of them, social isolation triggers a lot of depression and anxiety. There are like voluntary organizations like the Samaritans Mind, who are a 24-hour service. I mean, Samaritans is a 24-hour service and is available in the UK to everyone. Is highly confidential. Most of them are not mental health professionals, but they are also trained to provide support to people, I mean, suffering from a form of mental health, either depression, anxiety. They can support you and signpost you to services if you need them. They are very helpful. I mean, there are services, I mean, and with the services like single point of access, which is run by NHS, it's part of NHS. It was actually developed. It works like 111, but with single point of access, you have access to professionals. The difference between single point of access and NHS 111 is that with NHS 111, you describe your symptoms and you are triaged, and depending on what you present, the person you speak to will be able to speak to a clinician, will be able to advise you whether you need to go to A&E or you need to speak to a clinician or a doctor. But with a single point of access, you are likely to speak to a professional depending on what you present. But even if you don't speak to a professional, you might find that you find out that the staff there have access to your record, so they can either signpost you to the right services or liaise with your GP to be able to contact you on time. Because with COVID, what has also come up is, I mean, difficulty accessing services. I mean, things like GP where you could walk in, now you can't do that. Before, you could just walk into your GP, or you could just call and make an appointment, no matter how hard it is. I mean, you will still get an appointment or go as an emergency. You can't do that now. Your GP, you need to call. I mean, sometimes it takes a while to get an appointment. But I mean, in practical cases, where patients have come to clinicians, we are able to get through to GP and get them to contact the people. And I mean, triage it as urgent, because they've come through to us as a mental health service, and we have provided our support, and we need them followed up by GP. In that way, GP can contact you, I mean, urgently, than going through the normal route. I mean, it's the same for other types of, I mean, conditions. If you go through 111 or single point of access, in some teams, they have access to diabetes specialists, they have access to district nurses, they have access to occupational therapists, physiotherapists, they have access to social services. So it depends on which area you live and what services are available there. So it's important that we realize, so this is how COVID has changed things. I mean, we've had practical situations where people with mental illness have other underlying conditions like diabetes, hypertension, and they've actually struggled to get to GP or chemist to get their medication, and that triggers some level of anxiety. But once they get through to single point of access, we are able to contact GP. I mean, if the prescription needs amendments, I mean, these things might be taken for granted, or we might feel it's nothing. But to some people, it's such a big deal that it can trigger anxiety, it can even trigger suicidal thoughts, because they feel, well, COVID has, because the system has changed, there's no way I can access services, there's no way I can get what I want. So what's next? I'll rather not leave. And in children as well, I mean, I'll move to children's services. In children, there's a lot that is happening in that area, in the sense that a lot of children had their routine, especially children with special needs or childhood disorders, who some of them might be used to one particular routine. Now that routine is broken. So how do parents or how do institutions deal with them? Because they had a routine in the morning, that had been ongoing for years. Now all of them have to be stuck indoors by a computer, which is not part of what they had before. But all of them had to find a way of getting themselves, used to, or getting themselves, familiarizing themselves with these new changes. And it's not been easy for them as well. So with COVID, a lot of things has changed. It's impacted on not only patient, it's impacted on systems, the way we work, the way we provide services. And for people from Black and ethnic minority backgrounds, there's been like significant changes. So what the government has said is, since like a greater percentage of us work in the healthcare system, most of us happen to be frontline workers, we are now, we all need to have like a COVID risk assessment. So depending on the category from low to moderate to high, if you are high, they could make adjustments for you to work from home or deploy you to another area where you will not be too exposed. And if you are moderate, which it means that you can't really work in a red area, wards or areas where they have people with COVID. Because since COVID, even on mental health units, wards where people with mental illness are admitted, it's been divided. So there are specific wards for COVID patients only. and there are wards for non-COVID patients. So when the patient has COVID symptoms or have tested positive to COVID, they are put in those wards where they can receive treatment for COVID and for their mental illness as well. So the way services have been affected, and in some cases, some of these units are closed if the outbreak of COVID is so high, so they are not admitting, and patients have to be admitted to different units, or they have to be managed in the community. So the way it has affected systems is also imparted on the way services are delivered to both the vulnerable people in society, like the elderly, to the working adults, to the non-working adults, to children, and even to people who did not have. With COVID, it has triggered even psychosis in some people, because uh, with all these things happening, where people have been stuck indoors, imagine people who are living on their own, no family, no friends to talk to, no support network. A lot of them have developed all sorts of conditions because of the pandemic. And with people like that, there's services are available to support them, but some might not even be aware of the resources available to them. So, I'm using this platform. If you know somebody with mental illness or suffering from mental illness, signpost them to the Samaritans. It's a 24-hour charity for mental health. If you, wherever you live, either in London, outside, single point of access, it's your first point of contact. If you know anyone with mental illness, then if you need information online, the Mind website or the NHS website, the Public Health England website, has a lot of resources and information about mental health. But you can also look at Mind, which tells you about the different categories of mental illness. It tells you about the symptoms you should look out for. There's a lot of information about medication, therapies, and all that. So again, I'll also go to services like therapy for. A lot of people have been bereaved with COVID. People have had trauma. So there is IAT, is improving access to psychological therapies. It's all over the country. So with that, in every area, it takes a while, to get a response, because they have a long waiting list. But and it's a self-referral. You don't need to be referred by your GP. You can contact them and refer yourself. Sometimes they will ask you to go online and fill a form and do a quiz. But so once you meet their criteria, they should be able to provide any psychological support that you need. And also, if there's anyone going through domestic violence, if you are aware of anyone going through domestic violence, let's be each other's keeper. Try and encourage them to report it. If they are not willing to report it and you are aware it's an abuse, don't make sure they don't, raise an alarm, raise an alert. Even if they fall out with you, you've done your best, because you will not forgive yourself if that person who is being abused ends up in a very difficult situation, or they end up dying from their perpetrator. So always raise an alert with social services or call the police to intervene, because with COVID, what came up as well is that a lot of people who were subject to abuse, domestic violence, emotional abuse, any form of abuse, experienced, were at their worst moments, because the abuser or the perpetrator had more access to them, because if the perpetrator, had something to do like work, and the victim also had to be going for activities whereby all these activities have been cancelled, and they are living under the same roof with the perpetrator, they are more, likely to suffer more abuse. So if you are aware or you know anyone who is likely to suffer from these things, please be each other's keeper. Also, if you know any vulnerable person who is on their own, do not have any support, please reach out to them with a phone call to say hello, reach out to your neighbors, check on, because a lot of things have happened where people have died in their rooms without other people even knowing. Check on your neighbors, check on your friends, check on your family. I know we are in tier 4, we can't visit each other, but a phone call, that one phone call could save somebody from doing something bad to themselves, like, because a lot of people are committing suicide, are taking overdoses because they have no one to talk to, they have no one to reach out to them, they are anxious, and some people have lost their jobs and they don't know how they are going to cope. Sometimes just that word of encouragement, just that emotional support is as important as giving them medication. So please, let's do like a welfare check on each other. We do hear things like, oh, people from ethnic mind, we are overcrowded in our communities. In a way, it has its own advantage and disadvantages, because being overcrowded means there's a lot of support if that person needs it. In some communities where mental health is seen as a stigma, where mental health is not something spoken of, that community is able to manage that problem. In some cases where such issues have come to light, it will only come to professionals if it's gotten to a stage that is so, it cannot be managed by them. But in several of these situations, you notice that the families, or because of the support or whatever they were, the support network and the way they stick out for each other, that those people had survived, without any professional support. So we might come from backgrounds where we are overcrowded. We tend to reach out to each other, but it has a lot of advantages. In communities where, each one for himself, God for us all, it's very difficult. It's so, you find a vulnerable, you can find a vulnerable person, an elderly person living on their own. They don't even have anyone to talk to. They might have children, they might have family, but they live on their own. They just, they get on their normal routine, and a lot of them are depressed. They have nothing to, they don't even want to see another day, because they feel life is not worth it, because they have nothing to live for. So it's very important that we look out for each other in terms of with this pandemic and what it has, what has happened. It's going to be like this for some time. With the vaccine, we are hoping that there will be an improvement, things will be better. But until we get to that stage, how do we manage the risk? How do we manage mental health? How do we deal with each other? So it's very important for us to acknowledge these things and reach out for each other. So thank you very much. Once again, thanks to Nadia, thanks to the SJS awareness team.